The rotator cuff tendons are a collection of tendons that forms a cuff of tissue around your arm bone. The shoulder is a ball and socket joint. This is an inherently unstable joint, and therefore the role of the rotator cuff tendons are to keep the ball centered on the socket throughout a full range of motion of the shoulder. There are two types of rotator cuff tears, traumatic and degenerative. Traumatic tears, as the name would suggest, are usually due from an isolated injury such as a car accident or a fall from height. Degenerative tears are far more common. They are a result of an accumulation of small injuries or just simply wear and tear of the rotator cuff tendons over time. The incidence of rotator cuff tears has been found to be as high as 30% in patients over 60 years of age. This incidence increases to 65% in patients over 70 years of age. There are two primary reasons for this high incidence of degenerative rotator cuff tears. Number one is the blood supply. The blood supply to the rotator cuff tendons is fairly poor. Therefore, it limits the ability of the tendons to heal themselves. This can lead to an accumulation of those small injuries or wear and tear factors over the years, leading to full thickness rotator cuff tears. The other reason for the high incidence of degenerative tears is the relationship of the rotator cuff tendons to this bony bridge above. This bony bridge consists of your collarbone and a portion of the shoulder blade that wraps around the front of the shoulder called the acromion. Now, your rotator cuff tendons are soft tissue. The bone is hard and coarse, and so with particular movements of the shoulder, such as above shoulder level, those rotator cuff tendons are rubbing on that bony bridge above. Over time, this can lead to mechanical irritation and tearing. Degenerative rotator cuff tears are treated somewhat differently depending on if they are partial or full thickness tears. Partial thickness tears usually respond very well to conservative treatment, which consists of formal physical therapy, oral anti-inflammatories, and plus or minus a subacromial steroid injection. Full thickness tears can also respond well to conservative management, but most rotator cuff repair surgery is performed on tears that are full thickness in nature. In my hands, rotator cuff repair is performed as an arthroscopic procedure. That means small poke holes rather than a large incision. We use an arthroscope that physically looks like a metal straw, but it's a high definition camera that allows me to see in and around your shoulder on a monitor. Through the other small poke holes is where our instruments are placed. Rotator cuff tears do very well post-operatively, but there is a significant post-operative recovery that is involved with them. They are performed as an outpatient procedure. In general, in my experience, patients who undergo rotator cuff repair are very pleased with their post-operative outcome and are ultimately happy that they decided to proceed with the surgical repair.